We're taking away the stability from the hands, but the foot flat flush against the wall still gives that little bit of additional support. And we're really focusing on single leg load on this stability one, active hip abduction with this leg, but utilizing the wall just for a little bit of help. Now this is the first part of almost like 3 stages of what you can do to enable someone to get up to what's my favorite exercise. This is like the easier version, but this is a great starting point. And often patients find that the wall is really reassuring to enable them to do the exercise well. But this is exactly what we want to see. Nice stability, nice control, nice dissociation between the moving leg here and everything else. What you don't want to see is all this compensatory activity in the trunk, which isn't occurring from our patient demo here. Now, as this starts to get easier, introduce the band. So if we put the band around your knees, or around your thighs, I should say, bottom of your thighs, we're going to do the same exercise, same movement, same support from the wall, but we're adding in that resistance component. So same type of exercise, hold and then back in. You don't necessarily need an isometric hold at the end, but you just want to make sure that the quality of movement is not rushed. And this is perfect here. And actually, as you start to throw in the band, this is when things start to get a little bit more challenging, but also fun. This is fun. You don't want it to be boring. You don't want it to be easy, too easy. They'll get used to it, they'll forget, they'll move on to the next thing. Make it challenging, but you can see here, the patient is demoing it really well, but the challenge is far increased from the first one, and you can see it's a little bit more challenging for them to do. If having done that, over a period of weeks, however many weeks, they've increased that difficulty, they've improved it, it's got a lot easier, then we'll move on to the full exercise. Now with this one, what we're going to do is have the same starting position on that stability leg. So stand on one leg, bend that leg, perfect. Have a slight bend in your right knee now, almost like a little call to dip, perfect. And then do exactly the same exercise as you were doing before. So the wall has been taken away. Their safety blanket is there no longer. You're really making them focus on not rotating the hip. And actually, interestingly, this leg did rotate slightly on that last one. So you want to make sure that that leg is as one limb, just abducting slowly out and back in. Now, when I'm correcting this patient, I'm not standing there saying, don't rotate, have a little rest. I'm not standing there saying, don't rotate, don't do this. Just a little bit of tactile feedback to give him that feedback on how to correct it, and then let them do it. I'm not trying to overwhelm them with too much information.